Hey you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before starting with any of the questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, 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 you guys. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nurses Studio. I provide nurses as well as nurse practitioners with success on boards as well as in practice. I do this with either review courses, my review books, our one-on-one sessions, videos, etc. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with a 99% pass rate on all of our comprehensive courses and a 100% pass rate on our one-on-one sessions. Now, y'all remember yesterday I told you I was getting ready to take our youngest daughter, Grace, to the zoo for her class field trip. Oh my God, y'all. And here in South Carolina, the pollen is always ridiculous, but this year I think it's like on steroids or something. I'm not even a bad um like seasonal allergy girl, but yesterday must have really gotten me because listen, I'm sounding like Brandon instead of Brittany right now, but roll with me. What is it? I guarantee I have the all the signs, the boggy nasal mucosa and all of the things. But y'all just roll with me. I'm still gonna just show up and do all the things, even though I'm sounding in and out. My voice is like all nasally and manly, but y'all get it. But yes, you guys, a few things before we get into everything, because I just went sidebar. But listen, a girl is struggling right now. I am Claritin down and trying to do all of the things. Um, but yesterday, y'all know I did a sale to celebrate, all of you guys that have been passing recently. Y'all have done an amazing job. All of y'all in our one-on-one sessions. I know I give y'all these things, and sometimes y'all like, what is Brittany doing? And I always say, trust me, there's a method to my madness. And it is paying off for y'all. And just to congratulate y'all, to show appreciation for everybody showing up, I just wanted to do something to kind of give back to you guys on yesterday. And y'all didn't take any time. So I look forward to working with you guys who signed up um, for the sale. But anyway, I want to get into my disclaimer and then we'll get into the questions. I know some of you have sent some things, that you wish you had or what have you. But if you give me specifics, if there's something that you struggle with, let me know and I can do videos to try and help you in those areas. Okay. But as always, with the disclaimer, you guys, y'all know there's no absolutes in medicine. We treat on a patient by patient basis. And I just like to always say this because I design these questions. And when I give you the questions, they're based on the guidelines that are currently being tested on boards. Okay. So on the ANCC and the AAMP, this is what the guidelines they're following right now. I know that this varies from what we do in practice. And if I'm teaching on stuff that we currently do in practice, I will always say that so there's no confusion. Okay. So with that being said, let's get into question number one, y'all. All right. So, question number one for today states a patient presents to the office today for follow up. He complains of decreased urination. Upon examination, the prostate is noted as boggy and spongy. The patient did express some pain during the digital rectal exam. Based on these findings, how should the nurse practitioner diagnose? Is it A, BPH, B, prostate cancer, C, prostatitis, or D, is this a normal finding? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first because this allows you just to slow down, and ensure that you're answering what the question is even asking you, right? So here, the stem of the question states, based on these findings, how should the nurse practitioner diagnose? You know what I always say. So look at what they're asking you. They say diagnose. We need to run it back and see what assessment findings we have, right? So the patient comes in, subjective findings they're telling us, right, for the assessment. He's having decreased urination, um, and that's what he's complaining of. But the nurse practitioner on exam notes that the prostate is boggy, spongy, and the patient has pain during the digital rectal exam. So when you think of these things, you got to understand the presentation, right? One, let's go down the list. For benign prostate hyperplasia, A, that's not your answer. Typically, when you're doing your digital, they can't have the decreased urination, the dribbling, but on exam, the prostate is going to be enlarged, right? Uh, B, prostate cancer. One, even if you don't know how the prostate may present, you know that it takes more than just this for us to go straight to a prostate cancer diagnosis, right? C, prostatitis. Yes, that's your best answer. Making sure that y'all remember those key identifiers: boggy, spongy, um, pain with the digital rectal exam. Classic presentation for prostatitis, okay? So C, prostatitis. All right, question number 2. A patient presents to the office today with complaints of greenish vaginal discharge. Upon examination, there's noted cervical motion tenderness, and the nurse practitioner has a positive result for gonorrhea. Chlamydia has not been excluded at this time, but the nurse practitioner is planning to initiate treatment. What is the best treatment option based on these findings? Is it A, Rocephin 500 milligrams IM, B, doxycycline 100 milligrams PO BID for 7 days, C, Flagyl 100 milligrams PO for 3 days, or D, ceftriaxone 500 milligrams PO for 7 days? Take a moment and tell me what you got in the comments. All right, so stem of the question states, what is the best treatment option based on these findings? Same thing, they ask us for treatment. We got to run it back, figure out what the diagnosis is, see if they provided a diagnosis, go back, see what the assessment findings showed, so we know what we're treating, right? Always take a moment, even if you're getting overwhelmed, take a moment, slow down, and say, all right, let me picture this person. All right, this girl came in, she's sitting across from me, she says she has greenish vaginal discharge. Okay, girl, something's wrong, we got to figure out what it is, right? That's her subjective finding, right? So now we need to observe and do our assessment, right? And y'all, again, I'm telling you, I teach you in this way, they test you in this way, we practice in this way, we document it this way, right? Because think about it. And I say all these things so you can tie it together. Subjective in that assessment. She said that she has greenish vaginal discharge. Now we have to say something, which is the O in the SOAP note, right? Objective findings. What do we see? We noted that there was cervical motion tenderness on the exam, and she has a positive gonorrhea test result. All right. Okay, so there's our diagnosis. We have done our assessment and diagnostics there, right? Okay, so cool. So typically, gonorrhea, chlamydia, we usually try to identify both. But if treating, you want to co-treat unless it's that's a whole other story for a whole other thing. You want to co-treat because we haven't excluded the chlamydia, right? So what? How do we treat? How do we treat in the event of these two? Are we going to go with the Rocephin? No. Now, Rocephin 500 milligrams IM is good, right? For gonorrhea treatment alone. But we haven't excluded chlamydia, so we need to co-treat this. So B, doxycycline 100 milligrams POBID for 7 days is the best treatment option here for the co-treatment of gonorrhea and chlamydia, okay? All right. We're not doing Flagyl. And then D, ceftriaxone is Rocephin, you guys. And if y'all notice, I commonly like to put things in here like this where you may see similar medicines because I shouldn't say similar, the same medicine in the brand name and generic name because I want y'all to start to practice to implement these medicines knowing brand and generic because on boards, they may say one versus the other. Okay? And if they do provide it to you on the AANP, it'll be initially, and then typically they don't continue it on out. But know your medicines, okay? All right, lastly, question number 3 for today. A patient presents to the office today with continued complaints of lower back pain and noted urinary incontinence has begun. The nurse practitioner is reviewing the radiology report, and there's noted compression to the lumbosacral spine. Based on these findings, how should the nurse practitioner diagnose? Is it A, ankylosing spondylitis, B, arthritis, C, cauda equina, I know I'm always butchering that, or D, a back sprain? Take a moment, tell me what you got in the comments, you guys. All right, so stem of the question states, based on these findings, how should the nurse practitioner diagnose? All right, so we got to run it back and see what our assessment shows. Patient came in, they're stating that they have continued lower back pain. They're starting to realize that they're having urinary incontinence. The nurse practitioner notes on the radiology report that there's compression to the lumbosacral spine. Y'all, these are all classic key identifiers for C, called Akita, right? That low back pain, even though this is very rare, low back pain, incontinence, this is an emergent finding. Um, the report that lumbosacral spine compression, this can lead to paralysis. So when any of these things present like this, you want to refer out for further management and treatment for potential emergency surgery to prevent potential paralysis. Okay. All right, you guys. As always, I hope you found this helpful. Be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure y'all meet me back here. If you need any of our assistance, I know I've been getting everybody reaching out recently. In the past couple of days, y'all been asking about my next 5 week intensive. My next one is in June the 10th. Enrollment will be opening. Some of y'all have already started signing up, and that's completely fine. But yes, I'm still currently in a 5 week intensive, so y'all will see that enrollment stuff coming out. But if you need any of our resources, review books, there's an ebook and there's the paperback option. Both links are in the bio for you to easily access. Ebook, once you purchase, you have instant access. You can see it on all devices. Um, and they're the same thing, it's broken down by system. It is in color. I have pictures included because y'all, I'm a visual learner, so I try to help you tie it together. I'm a charts girl, so you'll see charts with certain things there. um, each system has interactive sections, so you know how I'm talking about the assessment, the diagnosis, the treatments, all the things to get you to just fill those blanks in after you have reviewed. It's short and sweet breakdown. It's not the textbook where it's going to give you so much of the back. This is, hey, I'm on the go studying type thing. Bullet points, to help you tie it all together, broken down just like how I teach assessment, diagnosis, evaluation, and treatment. And then there's practice questions as well in the back with rationales. Okay. And so that is ebook and paperback. We do have a self-paced review course. It is $89.99 per month. Prescription, you can stop. Subscription, look at me talking about prescription. I prescribe way too much. Subscription per month. Oh my God. And you can end at any time. And we also offer our one-on-one sessions that is utilized in many fashions. So if you have a weakness that you need assistance with making a strength, just let us know. That's one route you could take. And then the most common one is our custom package, where if say you've had an unsuccessful attempt on boards, we take that, we gauge your readiness, we gauge your weaknesses, we structure a plan to help you adequately study and prepare and find where your weaknesses were, and to give you a structured study plan and work alongside with you to get to a successful test. Okay. So if you need any of those things, and if you're even unsure of what you need, I always say just give us a call. You can even shoot a text to that number or email us. We will get back to you and help guide you on what you need or recommendations. But just give us a call at 803-400-6864, or shoot us an email at the nurses studio, the number one, at gmail.com. But as always, make sure y'all meet me back here. Hopefully, Brittany will be back tomorrow and I won't sound like Brandon or worse. And happy studying. Bye, y'all.